Well, partner, welcome back for another episode of our podcast, talking to our community about Chesterfield County Police Department. I'm Officer Skinner.
And I'm Elliott, and we want to thank all of our listeners for coming back, and we have a really exciting and important show today.
Again, we talk about that partnership we have with the community, and now we got a great program, some of the coordinators and some of the facilitators for the group SAFE.
Yes.
In our community. So we want to go ahead and get them to introduce themselves to us.
Absolutely. You know, we do a lot of partnerships across the community, business, private, and most people know we work with other law enforcement agencies. But today what we're going to highlight is our SAFE program.
All right, excellent. You want to start up, Ms. Bond? You want to start up?
I'll go ahead and start off. I'm Regina Whitsett. I'm the Executive Director of SAFE, and SAFE stands for Substance Abuse Free Environment.
Okay, a little bit about yourself. Give me your background and where you're from. How did you get started into this program?
Well, I used to be a trial paralegal, and I quit that after about 12 years and wanted to help people heal from substance use disorder. And so I used my background and life experiences to go into the prevention field.
So you followed one of your passions and
Yes.
made it happen.
Yes,
Great.
I did.
That's always good.
Okay, Ms. Bonnie?
My name is Bunny Chidester. I'm a prevention specialist at SAFE. And my path that led me here is I have most of my adult life been a domestic and sexual violence advocate and worked a lot in the field of prevention, especially with youth, to prevent folks from ever being victims or perpetrators of either of those. And that's my passion. And so the prevention naturally led to me being a prevention specialist with SAFE.
Okay, so how long you guys been together now?
Well, SAFE has been in existence for about 23 years now in Chesterfield County, and it started back in 1999 as a result of a drunk driving crash on Beach Road. And I've been with the organization for about 10 years, and Bunny's going on a year with us.
Okay.
Now, SAFE is a nonprofit, but you work with the police department and other entities. How did that, I know you said it came about because of a drunk driving accident, but the partnership, you have a lot of people on your board. Can you explain the structural makeup of the organization?
Yes, so we have a 16-member board, and it's made up of both public and private sector. Actually, Colonel Jeffrey Katz is our immediate past chair of our board, and we also have Dr. Doherty with the superintendent of Chesterfield Public County Schools. He's on our board, and we have prevention services on our board. We even have parents who have lost a loved one to overdose, and a parent who has a daughter in long-term recovery from heroin addiction. So we have businesses, CPAs, bankers. We have a wide array of directors on our board.
Okay.
Now, is your prevention efforts only focused toward youth, or is it focused toward the community at large?
It's focused towards the community at large. Our main focus is when SAFE started out, it was about preventing underage drinking and preventing access to tobacco. And then as the years progressed, we found out that, the 18 to 25-year-olds are an age group demographic where they have a lot of drinking and driving. So we had funding for that. And also now with our medication takebacks, we focus on the older adult population, grandparents, seniors. And Bunny, you can talk a little bit about that with the older adults.
Yeah, I mean, we have a lot of focus on safe storage and disposal, where we distribute disposal pouches and lock boxes at events and just to interested parties.
And those are for drugs that are prescription drugs or narcotics or something like that?
Yes, so to keep anyone else who's in the home, especially youth, from accessing.
I think you walked us through earlier about coming to the police department. We just did a drop-off point at the police department. Can you explain that, how people can get involved in it? They got medicine cabinets but full of old drugs, prescription drugs, and how do they come and drop those off?
Here at headquarters?
Yes, at headquarters.
Yeah, there's a drop box right here at headquarters, and about 4 times a year, there's a take-back event in the community that we help to publicize also. They can check our website for that. The next one will be in April, where you can come to an event where there's a place to drop your medications, and then you can also receive a bag from SAFE that our Youth Coalition has helped to prepare of educational materials and a disposal pouch in each bag.
So when people come to the drop-off of the drugs that they want to give, there's no police checks being done, and it's completely anonymous. They just drive up, drop off, and they leave.
That's correct. No questions asked. There is, we don't accept sharps So they have to dispose of those in another manner. But yes, there's no questions asked. They come in, they drive through, they give the medication bag to the officer, and then a volunteer will hand them the safe bag of literature. And then their unused medications are out of the access of people that don't use them or don't need them.
So with the formulation of SAFE, why do we need such a coalition?
Well, our mission is to engage community stakeholders, community partners, such as the police department. And we can get funding because we're a nonprofit, but you all are the experts that are out in the field every day with the citizens. And you see some of the issues, and you've actually called us to the table. The police department, fire EMS, and the Department of Health called us to the table because you said you couldn't arrest your way out of the opioid crisis and that you really needed to convene all of the community stakeholders together to start addressing that. So we do have an opioid and heroin prevention task force, and it has about 30 members on a regular monthly meeting basis. And we have different committees. We have law enforcement, that is a portion of it, but we also have education prevention. We have treatment and recovery. We partner with the treatment and recovery folks in our community. We have an opioid heroin treatment resource card that has information for people who may want treatment. And actually, the police department asked us to create that card. And it's out at all the libraries and around town. It's been sent out in utility bills. One of your majors, that was his idea to do that. But we just want to be able to convene all the people that can reach those that may need help.
Okay, and Ms. Chidester, as a prevention specialist, I'm sure you work with hotels or places where people may encounter folks who are using drugs. Can you talk a little bit about the outreach that you do as a prevention specialist?
Yeah, SAFE recently on August 31st was International Overdose Awareness Day. And the way we celebrated it was to partner with the Chesterfield County Police Department and Chesterfield County Mental Health Services and went distributing to hotels, motels, apartments, complexes, convenience stores, the opioid heroin treatment resource cards. And we had about 325 in Spanish and 325 in English were given out that day. And we got a lot of good feedback. There was already, it's really important, I think, to note, there was already a good rapport built between the community police and the places that we went. You could see that all day long. And they were thankful that we were there and that the police were there, and they were talking about putting these resources in the packets that they give to guests in their rooms and people that are coming through there. So I think it was really a successful event. That was just one example of a successful event that was related to that.
Good. Now, I know we're talking locally right now. We're talking the partnership we have with the police department, the fire department, and in the medical field or the medical areas. But what about regional, nationwide? Is it a partnership with you all throughout our country?
So actually there's community coalitions all across the country, even in the world. And there's a national organization called Community Anti-Drug Coalitions of America. And a lot of the community coalitions are members of that organization, and they are up in the D.C. area, and they actually advocate at the federal level on laws around substances. And there's about 5,200 coalitions across the country. And regionally, there's a couple of things going on here in the Richmond region. There's a Central Virginia overdose working group that's run out of the U.S. Attorney's Office that's meeting on a regular basis. And there's also Community Coalitions of Virginia. That's at the state level. And the majority of the community coalitions in the Commonwealth are members of Community Coalitions of Virginia. And they provide education. They have a rally day down at General Assembly where the prevention voice can be heard. And we have sister coalitions. Chesterfield has been very fortunate. SAFE has been around, like I said, since 1999. But there's also Henrico Too Smart to Start. There's Hanover Cares. There's a coalition in Powhatan. There's Friends of Prevention in Richmond. So the community coalition organizations, they're worldwide.
Okay, yeah. Good.
Now, I've noticed in the media that alcohol sales in Virginia have been really through the roof during the pandemic. What impact has that had on what you do in prevention?
Right.
Well, actually, we just had our annual meeting last Thursday, and Dr. Gay, the medical director at the jail, presented on alcohol. And he said that before the pandemic, they were seeing more heroin inmates coming to the jail who had heroin use disorder, and now it's flipped, and it's alcohol use disorder is the majority of the inmates that they're seeing. So then they're having to deal with detox issues that are very different from heroin withdrawal.
Did they say why? Did they say any reason for it?
I think first of all, access during the pandemic. There wasn't people weren't out and about with the lockdown as much, and but yet the ABC stores were still essential businesses and open, and so they, people who before the pandemic did not have a substance use disorder, all of a sudden are drinking at home. They don't have to go to work. And so alcoholism went up during the pandemic for sure. And alcohol sales went up as well.
And have you seen any impact on the pandemic with youth usage, whether it's heroin or I know fentanyl is a major issue if you want to speak about what you've seen with fentanyl recently or within the last couple of years.
Well, I actually know that there was a 72% of the overdose deaths in the past year were from fentanyl. So what SAFE has seen in our work with the police department is when we first started back in 2010 to focus on getting the prescription drugs off the street, but that happened, and then people started using heroin. And now, we're using Narcan to help with the heroin overdoses, and the drug dealers are starting to lace everything with fentanyl. So, and fentanyl is a much more deadly, dangerous drug than opioid prescriptions or heroin. So that's what we've seen.
But have you seen an increase in any of our kids using either vaping or?
Actually, the vaping between with the high school students was about 2 million high school students vaped before the pandemic.
2 million.
2 million.
Wow.
But over the course of the pandemic, that vaping usage actually went down because the youth had less access to the vape products. They were at home with their parents, which goes to prove our point that if young people don't have access to the drugs, it's less likely that they're going to use them.
Right.
So it is really about reducing access and availability.
So what about the alcohol for youth? Did that increase?
The alcohol use, we don't have that data back on that yet. And we're doing we just got done administering our youth survey. So we'll have that data in January. And it's going to be interesting to see if the youth were drinking at home, while the parents were there.
So the youth survey is one of the means that you use to gauge your success.
Yes, that's correct.
And do you do it every year, every 6 months?
We do it every 2 years.
Every 2 years.
In the schools.
Chesterfield County Schools.
Yes, Chesterfield County Schools,
Right.
8th, 10th, and 12th graders.
I know we've used some of your data in some of our instruction at our police training academy about trends of drug usage and things like that amongst the children in Chesterfield County.
But I wanted to back up just a moment about the drop-off for drugs, any type of drugs. Is that any time I don't just have to wait to the 4 designated times you all can drop off, but if I'm having problems with my child and I found drugs in their room, can I just bring it to the police department and drop it off in one of the drop boxes?
The prescription unused medications, yes.
Okay.
Yes.
Okay. All right. Because we talked about the 4 times that we can do it, that we scheduled to do that. We can bring in a bulk of people to come in and just drop them off and be ready for it. But I'm just thinking about the individual parent or citizen that says, I got a problem with Daryl Skinner, and I found drugs in his room, and I want to come and drop him off at the police department. So we can do that. We do that.
The prescription drugs.
The prescription drugs, yes.
Okay. All right.
And I know you also have some materials at our county libraries. And
Yeah.
What materials are there for the public?
The opioid heroin treatment resource cards, where SAFE has partnered with other public safety agencies to put a card together for people that need information about recovery resources and treatment resources. Those are in Spanish and English. And then we have the Don't Be an Accidental Drug Dealer cards, which are about safe storage and disposal, teaching people where they can get disposal pouches at all the Chesterfield libraries, and how important it is to lock that up, like you were talking about with the parent and child. And we have those in English and Spanish and Vietnamese now as of this year. So not for any reason other than the communities were asking for more languages.
Right.
So we're working on that.
And how do the disposal pouches work? Do you put the drugs in it and destroys them somehow, or?
Yes, they. I believe it's carbon inserts, and they put the pills or patches or the prescription medicine liquid in the pouch and add warm water and shake it, seal it, shake it, and it makes it inaccessible. Like you can't use it after that, and it also keeps it out of the water supply and out of the landfills, which is really important.
Right. Right.
You know, the water is testing high for prescription meds.
Right.
So they're non-retrievable once that happens.
And I know one of the enforcement things you do, one of the preventive things you do is also with retailers who sell alcohol.
Yes, yes.
Can you speak a little bit about the underage alcohol purchasing, how that works, and who do you partner with?
I can. We have some excellent youth that are part of our Safe Youth Coalition. They're usually 16 to 19-year-old youth, and they go out with undercover Chesterfield County police officers, and they have a route with all of the off-premise retail licensees that sell alcohol, and the youth try to purchase, and if they're not carded, then the licensee and the clerk are cited, and if they do check ID and don't sell to the minor, then they get a thank you card saying thank you for keeping our youth in Chesterfield County safe.
That's great.
Yeah, the young people love it, and we usually work with 4 to 6 different officers, and it's a very well-coordinated effort. We do it in the fall and the spring when we have grant funding for that. And the last time we did it, the non-compliance rate was 14%, and we got it down in the fall. It was 14%, and we got it down to 12% in the spring. So just letting the retailers know that we're checking. And we send them letters before we go out, say, hey, we're coming, educate your clerks. Like, we want them to do the right thing.
Right.
So, and then we publish the people who didn't sell to underage. We publish their businesses in the Observer so that they're getting that positive recognition of doing the right thing for our community.
Okay.
Good. I think we're going to move to the liaison with the program, with the SAFE program from the police department.
Right. So in the police department, we have a number of activities that we do when we partner with nonprofits, private businesses, places of worship, and community members. And we also have, who's been here the entire time, is our Captain Richard McCullough, who's in charge of he's the division commander for our special operations.
Special investigations.
Special investigations. There you go.
It's close. I was in special
operations. It changed.
I was there at one point, but yes, now I'm in special investigations.
But Captain McCullough, we wanted to get your take on the partnership and your role from the police department in following one of our 4 Ps of our police chief.
If you don't mind, first introduce yourself. How long you been with us? I know you've been in so many different units. So.
Sure. Again, my name is Rich McCullough. I am a captain in the Special Investigations Division. I've only been over there for about 6-7 months now, but I have been with the police department for just over 25 years now. But yes, our work with SAFE is truly a partnership. They carry all the workload, and we're there to assist them. Truly, these two women here are fantastic. But our role within the police department is to partner with them in every way we can. They had mentioned some of the things earlier that they were doing, and it's not just special investigations, but coming from special investigations, where some of my folks are detectives in vice and narcotics. It's a natural kind of a fit. But a lot of the work they deal with, she had talked about some of these compliance checks. Our special enforcement team is typically the officers that help them with those. And then also she had mentioned CAP as well. So our community police go around and help them hand out these pamphlets. They had talked about several pamphlets. I think another one of the pamphlets, I don't know if it was mentioned, was the dangers of fentanyl, making sure those are getting out there as well. Because, again, like the hotels, motels, areas where you're going to have that heavy traffic, that this will really have an impact. That's an area where they try to get out, and it helps when our officers are able to get out there and assist them in that matter. So we enjoy working with them, and they are a fantastic group to partner with, and they've been around a long time. I was in a unit many years ago helping with these compliance checks, taking these youth out there, and they enjoy, the youth enjoy doing it. So it's a great partnership there too, because now you're bringing the community in to help other aspects of the community with the police department. It's a great pairing.
Right.
Good.
Now, have you all seen? You have any success stories you'd like to share?
Exactly.
Sure. I mean, excuse me, we talked about the International Overdose Awareness Day distribution. The Take Back events we consider a success. I think you mentioned the dangers of fentanyl brochures, and I think another success to me is just having local youth get involved in educating other youth because they listen to each other.
Oh, yes.
And
Yes.
so we have a PSA contest at 2 of the high schools that we host, and the students and teachers really appreciate that. We recently had a national media agency do a webinar just for the youth at the schools and for our youth coalition on the most effective prevention messaging and what works and what doesn't work. And that was very exciting. And so having the youth create messaging for the other youth, I think, is a big success. And they're just phenomenal, the PSAs that we get.
Now, if the community wanted to become involved in your nonprofit, how do they go about doing it? Is it even available?
Oh, yes. We have a website, is chesterfieldsafe.org. They can go there, and we have different pages on all of our different initiatives. They can donate there through PayPal. They also can follow us on Facebook, Twitter, Instagram. We have a pretty good social media presence with our drug-impaired driving messaging, because that's the 18 to 25-year-olds, and they're all on social media. So we want to, get our messages out there where it'll reach them. And we also are always looking for new board members from the community. Also our task forces, the Opioid and Heroin Prevention Task Force, the Tobacco and Nicotine Task Force. We're going to be reactivating our Marijuana Task Force coming up. But we always love to have people that are interested citizens in this topic to join our efforts. We need help.
Right.
It's a big community, 360,000 people, and it takes all of our partners and a lot of different citizen volunteers to help us
Take that
have
village.
an impact.
And I know with some of your outreach, you do go and speak to civic groups or places of worship or organizations or businesses as well. Is that
That's correct.
still?
We'll go
Okay.
speak to Rotary clubs, civic organizations, churches. We've had churches that have donated to our organization. We've had churches that have held events for their congregation. And that's always important because, they might not listen to, nothing personal, but they might not listen to a law enforcement officer, but they would
Right.
listen
Oh,
to
yeah.
a pastor
No
or
question.
something, to deal with it.
Right.
Right.
And what our end goal really is to get the stigma so that people don't have that stigma of there is a problem with substance use disorder in my family and I have nowhere to go.
Right.
Right.
And it's not okay to talk about it, because it is okay to talk about it. We want people to talk about it. That's how they get help. And that's how they change the behaviors.
Well, before we close out,
up.
do you have anything you'd like for our listeners to know or a main point? I know we've covered a lot of area, and I know you have your website, chesterfieldsafe.org, that it can go to get further information. But for those people who may not be computer savvy, like I'm not all the time, is there something you'd like to get out from prevention or about your program?
Like I just said, we need everyone.
Right.
Okay.
And don't be ashamed if there's a problem in your family. And educate your children. Talk to your children. I know one young man that said, substance use disorder is it's passed through the genes. It can be hereditary. And I had one young person say, just because it's in my history doesn't mean it's my destiny.
Right. Oh, yeah.
And
that's good.
That's
it's really
excellent.
good, right? Out of the mouths of babes, right? But just because there's problems in the family doesn't mean that the younger generation has to follow in those
Exactly.
footsteps.
Good for you.
And so
Good
that's
for
why
you.
we want to educate people to make different choices.
Excellent. Excellent.
Did you have anything you'd like to add?
We're recruiting right now. The youth are recruiting for the Youth Coalition. So if there are any youth interested in 14 to 20 years old in joining, they can also go on our website and see information about that or to contact us.
That's great.
Good.
Well, I personally want to thank you all for what you do. After 25 years of police, and I've seen the impact that drugs and alcohol have on our community, but I've also seen successes.
Right.
And I'm a firm believer that education and real talk amongst adults with young people
Works.
It's difficult, but
Yeah,
it
but
works.
it works. It
You
does
have
work.
to have those conversations.
Yep.
And it's good to know that you've partnered with the police department or we've partnered with you and all of the other community members to make this happen to benefit Chesterfield residents and visitors of Chesterfield County.
Exactly. Captain, thank you for coming by and
Thanks,
talking to
Captain
us and giving
McCullough.
that more. Well, partner, another successful.
Yes, Project
Broadcast.
Safe. Let's remind folks that ChesterfieldSafe.org is our website,
Yep.
and go there, get more education, volunteer, become engaged.
Yep.
We
and we definitely need the
everyone
community.
engaged.
Exactly. Get the
Exactly
community
right.
involved in it. But we thank you.
Well, thank you, and I want to thank all of our listeners. Remember to follow us on Facebook, all of our social media accounts, and if you're interested in a position with the Chesterfield County Police Department, just go to joinccpd.org. That's joinccpd.org. Thank you all, and see you in the next
Awesome.
episode.
Thank you.
Thank you.
Thank you.